All right, here we go. So this talk today is about type 2 diabetes. It's what we're looking at. Is we're dialing into, we've already done one on diabetes as a whole, looking at type 1, type 2, and different types of techniques and strategies and those things that we can do for that difficulty that you might have in your life. We're going to dial into type 2, and then we're going to get some good information today. But the first thing I always want to make sure you understand is what specifically is type 2 diabetes. A lot of people get confused about those types of things, and it's good to know what we're talking about here, because type 2 is where your body is producing insulin. Your pancreas is not having a problem producing insulin. The issue is it's not getting into the cell structure. So you have a high blood level of insulin because the doors aren't open. The cells aren't open to the doors, and it's not happening. And there's where the problem and the deficiency lies, is the fact that the porters, as we say, that open and close the doors to the cell, are not allowing that insulin to get into the body and ultimately provide the fuel that your body needs. Because what are we talking about? We're talking about glucose, which is fuel for your cells to do what they need to do. So you're fuel deficient in this type of situation. So we look at that. We want to talk about what are the potentials that could lead to type 2 diabetes. What are the things that could cause this type of a deficiency in the body? Well, we have poor diet. That's one of the main things we talk about. Being overweight is a major player when it comes to type 2 diabetes. It leads to a lot of root cause problems of why that is, and we'll talk about that a little later. Having high levels of inflammation. Now, inflammation is a good thing in the body if it's acute. However, if it's chronic and long-term, it's been there for a while, that's when we really start to see things break down. We see things to have difficulty in how the body functions, and it can lead to some other issues. So that's another area. Leading a sedentary lifestyle, that's another component that we have. Sedentary lifestyle is someone who sits on the couch. You've heard them as couch potatoes, but that's another one that can come up, is that if you're actually having that issue, that could be a problem as well. Experiencing high amounts of stress. Now, this is a stressful world we're in. We're getting it from family, we're getting it from work, we're getting it even because we can't even do the things that we enjoy, so our own personal life is stressful in ourselves. And so there's a lot of areas of stress that come into play that could be a problem. So that type of thing as well. Excessive high blood pressure, something you also know. That's going to affect how your body is actually doing as well. It can affect blood sugar because it's one of the control systems in the body. You've got to remember, your body is always trying to maintain balance. It's always trying to maintain homeostatic health. And when one thing is way out of control, there's other things in the body that are going to adjust to try to help and assist the thing that's out of control. And so that's going to have a side-to-side or a sister-to-sister type of comparison. When you have one system like high blood pressure, insulin and those types of things in the blood, well, you're going to have problems with that as well. Hormonal conditions, hyperthyroidism, polycystic ovary syndrome, Cushing's disease. These are areas that can lead to insulin issues as well, like type 2, where you can't get it into the cells. So that's another component that could be there. Being exposed to toxins, viruses, and harmful chemicals. Now, here's a pretty interesting thing when you talk about that. Toxins, we get bombarded by those. 80,000 a day come into your body. And it comes from the air we breathe, the things we drink, the medications we take, the supplements we take. A lot of things can become toxin in your body. And you've got to be able to make sure and understand how they're harmful, how can you detoxify clearly from those types of things. Taking certain medications, like those that disrupt insulin production itself. There are many that do that. And so many things, a lot of people today are on multiple levels of medication, and they counteract each other and many times and can affect other systems in the body. So we have that as well. And recently what we're finding is vitamin A deficiency is another issue that can come up and cause a type 2 diabetic scenario. So let's talk about the impacts real quick. How does type 2 impact us today? Well, today over 30 million are diagnosed with it. That's a pretty big issue in our country. 7.2 million have it and aren't even aware of it. So there's another 7.2 million that are walking around with it and they don't even know it yet. So that's a pretty big thing. 34 million are pre-diabetic. So even more than what are diagnosed are pre. So we know that we're leading into a very big problem in this country. 150,000 kids are already diagnosed in this country. Kids, we're talking 7-year-olds, right? Crazy. We spend over $245 billion in costs. Really not the most ideal situation either. 2.3 times more cost than healthy people. So when you are not diagnosed with diabetes, and you are, if you are, you usually spend 2.3 more amounts of money than the other individual just to take care of your body. That's a pretty big impact when we talk about that. In addition, what are the dangers? What are the comorbidities as we know them? Well, cardiovascular disease is one thing that accompanies it in a big way. Heart disease, stroke, diabetic ketoacidosis. This is the big thing. Ketogenic diets are the rage right now, and that's the big fear that doctors have, is shifting into ketoacidosis, where your body goes into an acidic state and starts eating itself. Very dangerous. Actually, there's a few diets out there that have led to that, and some of their creators have even fallen into those types of things. Leg amputations. People are very familiar with neuropathies and those types of things, and that can lead to some pretty big things. Obesity, obviously, is another thing that can be related to it. Loss of feeling in the extremities, those neuropathies, and eventually an inability to walk. Now, that's a pretty bad thing. So if you get diagnosed in your 40s, you can look forward to maybe by your 65 or 70, you may not even be walking anymore. That's a pretty big reason to start shifting and changing your strategy for quality of life. So there's modern day treatments that we do. We're always asked by our patients, well, what is the typical treatment that you're going to have? And really, we have to understand their strategy first, because their strategy is based off of a blood level test. They take a blood level test, they look at A1C, they look at your glucose levels, C-peptides, and they say, okay, if these are out of whack, we've got to do something to stabilize and manage them. We've got to bring them back under control. So the entire strategy is not to actually find the root cause of the problem and address the root cause and correct the situation in the body. It's how can we stabilize the situation and manage it. When you manage something, you don't cure it, you manage it, right? And so we have very specific things that we're doing. So what's missing? The resolve, the cure, and the other big component that's missing in today's strategy is supporting the subsystems. I'm going to get into that, and it's usually where really a lot of individuals don't understand the whole concept, and I'm going to kind of tie that in today. Remember that diabetics today suffer from many health issues due to the treatment that they're on, because we've got to remember that while we're stabilizing that stabilization has peaks and valleys in it. And when we have those peaks and valleys, we start to wear out body systems. Organs start to break down. We're really starting to put our body under a greater stress than what it's meant to be in. And we've got to make sure that we have that consideration as we're treating for these types of things. There's really two types of major treatments that they look at when we do modern day treatments. And one of them is going to be an alpha glucoside inhibitor. And what we mean by that is it usually goes by Archibase or Midodol. It's the two medication types that they have. And what this does is this helps your body to break down starchy foods, and it helps to break down table sugar. So in other words, it's going to help your body's organs break down sugars and get them into the bloodstream. So we want to get more bloodstream sugar so that your cells can get it, right? That's the strategy there. So that's one thing. Now let's think about that. If we're taking a medication to help your body break down things, what system are we dealing with? Digestive. And so here's one of the major components when it comes to type 2 diabetes, or any type of diabetic situation, is there's a system involved, and that system involves organs and hormones and all types of things to make this system control and help the body be successful. So this is one area that we have to make sure we consider, is what are we doing to help with the digestive tract. The other one is the more popular version that everybody really seems to go by, and that's they're called biguanides, and everybody knows this by metformin. Metformin is something that's very personal to a lot of type 2 diabetes. And what's this do? It actually decreases the amount of sugar that your liver releases into the body. So that's a very scary thing to do, because now we have a medication that's going to adapt and manipulate from the outside in how is the situation with the liver and how it's producing and what your body needs. So although your liver is reading the situation, understanding what's going on, we're going to manipulate its response to the body's needs. So again, we're dealing with another subsystem in the body. We're dealing with things that are going to really ultimately change cellular communication in the body. And that's where we have to really understand what we're doing. Is there another way than these two methods? There is. And actually, when I treat those types of patients, there's 4 critical factors that I do to address these issues. Number 1 would be resolve the hormone, the metabolic, and the organ system imbalances. So I always do those types of things when I'm treating these types of patients. We identify specific foods, minerals, and nutritional support so that we make sure that they have exactly what they need. Eliminate the toxins in their body and in their environment as much as possible so that we can eliminate the possibilities of that shifting and manipulating how the body is functioning. Remember, you're always an example of your environment. Your body has to actually evolve to address the things that are happening in your environment. And so it has to shift, and it has to do different things to maintain homeostasis. Activities for metabolic healing. What can we do to really boost metabolic activity? And we'll talk about that as well. So those are the 4 critical factors. Let's talk about resolving organs, hormones, and basically balancing those metabolic systems out. There's 2 main hormones that we talk about when we talk about type 2 diabetes. One of them is leptin, and the other one is insulin. Insulin is made in the pancreas, and insulin opens the door of the cells for glucose. So here we're talking about getting the cell. Because remember, type 2 diabetes, the sugar's in the bloodstream. That's not the problem. The problem is it's not getting into cells. Here we have a hormone that's involved in it. And when we think about that, hormones are what make the body do what they're supposed to do. So when we have a problem with insulin, in the scenario of being able to open up the doors of the cells, that's an issue that could create this problem, and it's one of the things we absolutely have to focus on. Leptin is another hormone. Leptin is made in your fat cells, and leptin is something that tells your brain that you're not hungry anymore. It gives you the sense of fullness. And what happens is you have insulin resistance and leptin resistance in the body. It leads you to overeat. It leads you to bring more fuel into the body, so you're overproducing fuel systems, overproducing sugar into the system, and your insulin is resistant as well, so your cells are resistant to them, so that it doesn't even open up and let the sugar in there. And therefore you have high sugar counts in the blood, and you're type 2 diabetic. And that's how that works. The takeaway here is this: addressing leptin and insulin resistance is vital. If you don't do these things and break through the metabolic miscommunication that is happening in these 2 hormones, you're not going to lead to a great success rate. And that's something we've definitely got to make sure we take care of. Resolving hormone and metabolic and organ systems, it also includes organs, and we have to focus on that. A lot of people don't understand the concept when they think type 2 diabetes, type 1 diabetes. The only thing they focus on is one organ, the pancreas. That's what they're really looking at. There's a lot of different things. In fact, the major organs that play in this system are the GI tract, the adrenals, the pituitary, the thyroid. They all have a part to play in this system of control because they produce hormones that either increase or decrease the amount of the body's sugar production. And so it's an entire thing. So in essence, if I have a thyroid problem, I could have an insulin issue in my body because the thyroid control system is overproducing and increasing the blood level in the body. And I've been treating it for type 2 diabetes when it's truly a thyroid problem. You've got to understand where the problems lie, because these are major components of what's happening. It's vital that we address these supporting sub-organs in the body, because if we don't balance these things out, you're not going to get to the resolution and the root cause. And that's what we have to do. Brain balance can aid in reducing the possibility of eliminating your use of medications. That's what we want to do. Medications are fantastic when we're first diagnosed, when we have acute care, and we've got to address it quickly. However, there should be another long-term strategy. How can we understand what's going wrong with the body, and is there a way to really create healing and resolution so that with a long-term strategy, you're not managing this situation, you're working towards resolution if it's a potential. And with type 2 diabetes, it is a significant potential that you can do that. So we have those things to take care of. When we talk about nutrition, that's another major component of it. We always go by the premise, let food be thy medicine. Not as easy as just stopping candy and stopping and eating greens. You've got to do more than that. You've got to have specific nutrition that is aimed at what your body specifically needs. So how do you do that? Do you go on Google and you make a strategy on Google to look up all the things that are healthy foods and incorporate those into you? Most people, that is their strategy. However, they might not know that some of those foods are really actually not the healthiest for them because their metabolism reacts to them in a negative way. You got to know that you know, and there's a way that we can do that. We utilize technology like biocommunication and screening and those types of things, to understand specifically what are the foods you need in your body to feed these subsystems and provide health, nutrition, and vitality to how your body functions. In essence, how do we put premium fuel in your body and not just low-grade stuff? And that's really what we want to do. You are unique, and you need to know that you know what you're getting. So you have that. When we talk about toxins and we want to eliminate toxins in the body, again, I mentioned earlier, 80,000 toxins bombard your body every single day. That's a pretty big number to face with. Guess what system has to overcome that? Your immune system. So as your immune system's in this fight, and it comes on when other things start to happen, like resistance of insulin and those types of things, how can that system, when it's bombarded by all these other things, step in and try to help you in that world too? Pretty soon you spread it too thin and you're going to have some problems. So we really want to make sure that we reduce the toxins that bombard your body as much as possible. So where do we get them? What you eat, what you drink, what you breathe, what you touch. A lot of people don't realize your skin is an organ, 22 seconds from contact into your bloodstream. That's a pretty big thing. So when you're out gardening and you're using these harsh chemicals, and you're getting them on your skin, men are famous for this. Oh, I'll just dump this stuff on the thing. It's not a problem. I don't need any masks or gloves for Roundup. I'll just start spraying it out there. It's in a nice spray bottle. It makes it clean and easy. But it gets on your skin and it gets on your system. And that can modify your DNA structure. So we've got to make sure that we understand that. What are the products that you use in the house? What are your cleaning agents? What are in your foods? What are in your personal care items? One of my favorite ones to look at is what is in your makeup. What is in the personal care items and the makeup? There are a lot of carcinogens in hair care and cosmetics out there that are really getting into the body in large because, yes, they tested it in a laboratory and in one exposure in a very controlled environment, it didn't do much. But when you use it every day for 24 years, what's the toxic buildup in that situation, right? It's a much different story. So we have to make sure we're reading ingredients. We use clean chemicals and we reduce our environmental toxins like smoke and those types of things. We want to make sure that our body is getting the best chance of survival when it comes to those types of things. Activities for metabolic healing. How can we really create metabolic healing through doing activities? Well, as we always say, get moving. That's the first thing. Your body has 208 joints. It's made to move. We've got to move. That could be walking, running, biking, doesn't matter. But you want to get up, you want to get out, and you want to get your body moving. Because when you get your body moving, it's amazing how the systems that we talk about, things like lymphatic systems, cardiovascular systems, these systems start to come alive in the body. The immune system starts to boost its activity. When you start to move, you start to boost everything that happens in your body. There's 11 systems that happen in your body, and they all start to actually get healthier and more viable when you're moving. And so that's a really cool thing. Step 2 is to make sure the exercise is right for you. Here's a big component. When you're doing exercise, a lot of people are going in and they're either doing something they've done forever, and they may not be getting the results anymore because their body has changed and they don't need to do that type of exercise to get a result anymore. Another thing is they may be going way beyond their body's condition level. For example, if you're doing exercise and your heart rate is going into the 160s and you're staying there for a prolonged period of time, you're in an anaerobic state in your exercise and you're actually breaking down and creating oxidative stress in your body while you're doing it. That's not a good situation. That's not a building health strategy. So we've got to make sure that we consider heart rate. We consider what the type of exercise is and what you're trying to accomplish. Are you trying to build? Are you trying to burn? Are you trying to balance? What are you trying to do in your exercise strategy? And make sure that it is right for the level of the body and the activity. The other thing to understand when we talk about activity is what type of burner are you? Are you an individual that is a fast burner? Are you a sprinter, a lifter, power lifter? Or are you someone that can run a marathon? And that works really well for you. Ideally, when you do really great activities for metabolic healing and you're done with the activity, you should feel fantastic after your workout. You should not feel exhausted. And that's what you really have to make sure you understand is we have to aim for you to have a metabolic activity that's going to create health, energy, and vitality in the body. And that's what we have to look at. So those are the types of things when we get to that. There are many types of approaches that you can do with this. In our office specifically, we have a couple different things that we do. One of the things is our Body and Balance program. it takes the guesswork out of all of these things that I talked about, because it approaches all four aspects, because it looks specifically at what are the hormones, what are the neurotransmitters, what are the systems in the body that are not optimally functioning. And then we develop a specific strategy based on your body's response as to what you can get out of it and how we can make sure that we resolve to the best of our ability the challenges that your body is facing under the conditions in. We also can identify with this type of program specifically what the foods are. We can actually stimulate the food signature into your body and see what the cellular response is from your body's system. And now we can identify what are the best balancing foods for your body, what are the most stressful foods for your body, so you can clearly understand what are the best choices. What can I really enjoy that are still on my list and really create balance in the body rather than stress. Elimination of toxins in the body. Well, we go through a whole detoxification process on this program, detoxifying the organ structures, detoxifying the foods, and getting your body as healthy as we possibly can through that process so that that system is now running as well as it possibly can as well. We suggest specific types of exercise through this program too. We may actually come in and have a patient come in and we may look at them and say, you know what? Circuit training is the best thing that your body likes to do. It's actually based on the genetic predisposition that you have. That's the type of program that will be best for results in your body. We may say cardiovascular would be the right thing. It may be something like Tai Chi. You don't know what the specific thing is until you really evaluate what your body needs. And then ultimately, we actually utilize a whole encompass program that's specific to you. Specific supplementation that's for your body and won't turn toxic in the body. We use specific plants for calories that are specifically to what you need. So that's the type of program that completely come in and transform how your body is functioning. And that's a really good thing as well. When we look at another program we have, it's called EDS, electrodermal screening, and that can come into play in a lot of different ways as well. Because when you think about it, a lot of people have, I don't know what really the big toxin is in my environment. How would I guess and find out what that is? We can test and find out. What are the biggest challenges your body are facing? Are there viruses? Are there parasites? Are there funguses? Are there molds? Are there specific things that your body needs to really overcome that? And we can come in and we can create a very specific solution, again, to your body so that you know that your protocol is going to affect specifically what is challenging your body. And this is a very, very critical component that we can add to your specific program. So that's another way that we can do that. So there are multiple approaches that we can take to change and transform not only just a diagnosis that you have, but really drilling down and understanding what are the areas in this diagnosis you specifically have. Because one person may have an issue with the pancreas, another issue may have an issue with the thyroid and pituitary system, and so you have to know that you know how you're approaching it. Without that plan, you're never going to reach a result that's going to get long-term, gratifying success, and that's what we look for. Are there any questions at all? Dan?